Hello everyone, I'm Princess.
And I'm Jazmin.
And we are White Coats and Stethoscopes.
Wow, I thought you was doing the finger.
My bad. All right. This is our first YouTube channel. We have been very busy. And so we had class today and we decided to record today.
Yes. So we're going to talk about our ICU experience. ICU for me, it wasn't bad, but doing the clinicals, I just realized it wasn't for me.
So ICU in our clinical rotations, you're either in ED, or you are in ICU, or you're on like a med surg floor.
Mm-hmm. And
so the med surg floor is kind of like it was like more cardiac, people that have like heart problems. ICU was more people on ventilators. They have OG2s, they can't speak or anything like that. And then ED is like more like fast paced, like all the emergencies.
Mm-hmm.
For me, I feel like the ICU department was not for me. I didn't like seeing like the patients on the tubes or ventilators. That was just not something I wanted to do. ED was fast paced, I had a little situation in the ED that we'll make another video about self-care, making sure that you're not dehydrated, you're hydrated, and that you're eating, especially working in the ED, especially in a fast paced environment. But it was just interesting just being in ICU.
We had our CPU for, which was cardiac pulmonary unit, I believe. Was it pulmonary?
Yeah, it was like cardiac unit where we did learn about like the heart monitors with patients and stuff, pacemakers and stuff like that.
We both kind of like that because we're really good with our patho. So it was good for us to be like, okay, we know what's going on. But we didn't like it because it was so intense, and you only have one patient. You may have two max, and you're just trying to keep them stable, or you're administering meds. The patients are not really all the time up or alert, so it just makes it a little more difficult. I like the ED because you're really with the community, so I was seeing things from somebody coming in with an NSTEMI, a heart attack, or someone who may have had an opioid overdose, or things like someone who fainted at work, just things like that. And I enjoyed it because no day was the same. Like, you're seeing like so many different people, and it just keeps your mind working, and I like that. I like fast paced, and I like being like on the go, on the spot, and having to think about what I'm going to do to help this patient.
I believe when I was on there, I seen 2 cardiac arrest situations. So that was interesting too, just like seeing just all the nurses, all the doctors like work together as a team. Because in nursing, it is teamwork. Like, you have to work as a team to help a patient. It's not just like a one-man show. I did like ED because it's like different backgrounds, ethnicities. You can work with different people. You work with all sorts of different patients, different nationalities. That's what I enjoyed a lot.
And then when it came to our theory portion, we did good, but it was just hard having an exam every week. So it's like right when you go to class Monday, you're preparing for your exam the following Monday. So, and then we have to do like HESI questions, which are preparing us for our NCLEX, and you have to do like level 2 to those, which is about 300 questions total that you have to answer. So it's just a lot of work.
So you have to like balance out your life and plus like self-care, because sometimes you don't want to like over study or overthink and don't have that self-care.
And then you have to maintain a 73% for all of your exams. So all 4 exams. We didn't know that our first semester, so we doing good. I have a 90% total, and they were like, no, it's just for your exams. And I'm like, okay, so we had to get it together. We was like going to tutor and everything. So we were all just like, all right, we doing good.
So your exams,
we're not.
Your exams are different from like your classwork. If you don't get that 73 in your exams, like, you cannot pass.
So that's another thing. You just have that pressure with having to basically get a 80% and higher.
Exactly. Sometimes you don't have free time because we are studying. Sometimes we're studying every day for hours, more than sometimes 4 hours. It's just studying. But after you study, you have assignments due, you have work due, you have clinical things due, we have simulation too.
Sepsis was the most fun for me because it's like all hands on deck. So I was doing what was I doing? CPR. I was doing CPR.
We were together.
So that was just funny. We were part of the code team. So that was the best one. And then you get picked, and we just, it's a Vegas rule, but basically what happens in sim stays in sim. But it's just a great learning experience because you take what you're learning in STEM and then you apply it when you're out at your clinical site.
Exactly.
We're at school Monday through Friday. Sometimes Saturday, like they're trying to have us come on Sunday.
Yeah. So it's just things that you have, once they throw at you, you just go with the flow. But sim was great. I think the scariest part sometimes, because we have, our teachers can see us, but we can't see them. So it's like a mirror.
You have to stay in there for about 15 minutes sometimes. For this semester, we've been in there for like 30 minutes. I feel like.
So it's just, it's a lot.
Yeah. So that is ICU. I'm trying to think what else did we do in ICU.
We did a lot of things. We did like suctioning, you know, passing meds. We do a lot. You might do a chest tube removal, or doing fluids, hanging fluids, doing IVs. I mean, I think we did a lot of skills in ICU, also being on different floors.
And you have a lot of autonomy. Like for the ED, they're just like, all right, this is your patient. You have 3 patients.
Yeah.
Okay, Jazmin, go in there, hang the IV, connect the patient to the leads. And it's just like, I'm thinking like, oh my gosh, I'm not ready. And the nurses, like, they'll watch you from like outside the room, but they're just like, okay, like, you can do it, girl. ICU was good. We're now in maternity, so we'll probably make another video talking about maternity, and I guess if people want to know how we study, because we both study differently.
We'll also talk about, like I said, self-care. I mean, if you guys have any questions or want to hear, you know,
like, what do you guys want to listen to, or what do you guys want us to talk about? Like, any topics, we'll talk about them.
Like, how we maintain that 73%, how we met, a little bit about like case management,
and I'm FNP, family nurse practitioner, and just to remain. Princess and I are like, I wouldn't say, we're just goofy. So it's like when you're in such a high stress environment, just to remain like yourself, because it gets so stressful, and then your classmates can make you want to be stressed out. So I think just having fun and just remaining goofy and just trying to enjoy every moment makes it easier.
Yeah, like
if you're just so uptight, it's like it makes nursing school even harder. Because it turns into your family. You see your cohort more than you see your parents.
Exactly. Like, I see this girl every day, and then like you talk to them every day. Like, we be texting or calling, so it's just, you know.
I think that's all we have.
We will leave our Instagram info below.
So definitely like, subscribe, and comment. And just give us feedback. We're open to everything. We're open to hear what we can do better. Can't talk. And
So thank you for watching, and we'll see you next time.
All right. Bye-bye.
Bye.